So, like we saw in the last video, France is a high-income country, so communicable diseases are not as serious of an issue for them as it would be in like a low-income country. Generally, France has the resources to prevent and treat most communicable diseases, if not all of them. Only 6% of deaths in France are due to communicable diseases, but that's also combined with maternal, perinatal, and nutritional conditions altogether. The majority of their burden of disease is definitely from non-communicable diseases. On France's list of what causes the most deaths, only one communicable disease even made the list, and that was lower respiratory infection. Pneumonia is a large part of that statistic, but there are also a lot of complications that can come from acute bronchitis, bronchiolitis, influenza, and the whooping cough. Generally, those illnesses cause serious issues in children under the age of 5 or the elderly, and also like individuals that are living in low or middle income countries that maybe don't have the resources to deal with those illnesses. And on the list of what health problems cause the most disability in France, there were no communicable diseases that even made the top list. So France has had some trouble with their vaccine policy. There was an investigation in 2016 on public concern about immunizations, and France was found to be the most skeptical about vaccines as a country. If you look at the bottom map, the very dark red country in Europe is France, and they had the highest percentage of individuals that disagreed with the statement that vaccines are safe, which is kind of surprising to the researchers that were doing the study. However, at the beginning of last year, they changed the number of mandatory vaccines from 3 to 11. So they added 8 new vaccines to help reach the herd immunity threshold levels for these diseases. Unvaccinated children are barred from public and private schools and nurseries as a way to enforce this policy. Action was taken in response to a few different outbreaks that have happened in France somewhat recently. There have been 2 outbreaks of measles since 2008, which have resulted in about 31 deaths total. And then there was also an outbreak of invasive meningococcal disease that resulted in 105 deaths. So looking at the graph at the top, overall the number of cases of measles has decreased sharply since 2011. If you look at the little cutout in the graph, that's from the years 2012 to 2017, in case you can't see the dates on those. So, number of cases has decreased sharply since 2011, but as a whole, the country has not reached the ideal 95% herd immunity threshold for measles. So there are still a lot of deaths that would be easily preventable by just vaccinating more children, which was a big reason for this policy.
Non-communicable diseases, or NCDs, are responsible for the vast majority of deaths in France by far. These diseases are a result of many different risk factors, the majority of which are lifestyle-related. In its Strategy for Global Health published by the French Ministry for Europe and Public Affairs, it is noted that as a part of the continuum of services from prevention to care, France will implement the following actions to address and mitigate NCDs within the nation and beyond. It will share its experience and help implement specific action plans to encourage healthy lifestyles, including tobacco use, alcohol use, nutrition, and physical activity. It will step up tobacco control efforts and ensure that the WHO Framework Convention on Tobacco Control is applied. It will encourage people to be more physically active, given that a sedentary lifestyle is a threat to global public health, and encourage targeted nutrition-focused actions. It will promote testing, diagnostics, and rapid management of diseases. It will advocate a graduated and inclusive service delivery ranging from local to specialist care. And it will involve patients' associations, economic stakeholders, and healthcare workers in its prevention and care of non-communicable diseases. A majority of non-communicable diseases experienced by people in France are related to tobacco usage. France has a notoriously high rate of tobacco use. The French Health Ministry credits about 200 deaths every single day which comes out to about 73,000 people every year, to non-communicable diseases related to tobacco use as of a 2018 study. That number has significantly decreased, however, just even this year, as the French Health Minister Angus Bynum says the so-called sin tax is to thank. Not only are they implementing a higher tax on tobacco and other unhealthy products, they are encouraging a new trend by boosting state-reimbursed cessation counseling, nicotine patches, non-branded packaging, and a sharp increase in public health warnings about the dangers related to tobacco. One example of that is this controversial ad campaign that ran in 2010. The text reads, quote, "Smoke is to be a slave to tobacco." Now, obviously, this is a little problematic in its own right, and the campaign actually sparked a public conversation about sex abuse and victim blaming. That was maybe the only silver lining in an otherwise ill-advised and short-lived campaign, but it does show that public health officials are not afraid to pull any punches when it comes to tobacco use, PSAs. All efforts combined, smoking is on the downtrend in France, even if it is slowly. Although the ministry's report made no specific mention of electronic cigarettes, at a press conference, a member of the French Public Health Agency noted that e-cigarettes were, quote, "clearly the smoking cessation aid of choice. The long-term effects of those yet remain to be seen."
Overall, the nutrition in France is pretty good. They have low mortality rates, which corresponds with the high income country that they are, and about 3% of France is documented as undernourished. In terms of nutrition statistics for France, the World Health Organization recommends that the daily fruit and vegetable intake should be about 600 grams, but France falls short of that and they consume only 569 grams per capita per day. Salt intake is recommended to be less than 5 grams, but the French consume 9 grams per day for both men and women, so that's a lot higher than it should be. And as of saturated fat intake, the recommendation for that is 10% max, and the French consume 14.6% of their total calorie intake from saturated fatty acids. So overall, the French miss the mark for the recommendations, but in comparison to other countries such as the United States, they are doing fairly well. A. Obesity in France is only a slight issue. The WHO recorded in 2015 that 15.3% of France's adults are obese. In comparison to countries such as the US and Mexico and other countries listed on the table, this is a small number, but it's still also very significant. Obesity does affect French adolescents, and in the table it shows that the older you get, the smaller the percentage of overweight adolescents there is, but this is still a startling number that the French are trying to combat. In order to promote health and nutrition in general in France, the French government does a good job of creating programs that promote this. One of the main ones is Programme National Nutrition Santé, PNNS. It was founded in 2006 and follows guidelines from the National Nutrition Policy and has several goals, including increasing the consumption of fruits and vegetables, consuming foods rich in calcium, limiting the consumption of alcohol, increasing physical activity in daily life, and limiting the consumption of salt. Within this program, there is a plan called Obesity Plan, and their main goal is obviously to combat obesity in France. One of the most well-known initiatives that comes through PNNS is known as Manger Bouger, which translates to Eat Move, and it is an online tool that was developed to help the French citizens assess their current nutrition as well as provide tips and resources to improve. So as you can see, I put screenshots from the actual website where they have multiple resources where you can create a menu that shows you daily food intake recommendations. It can assess whether you're doing enough physical activity per day, and it also helps you if you want to find recipes or meal plans that will help you better your nutrition and health in general. To the left is a screenshot of a promotional poster in French that sort of just outlines their diet menu, what they believe to be healthy quantities of things such as milk products, meat, vegetables, grains, etc.
Although France is known by a lot of people for having some booming cities, some may or may not be aware that France has a very large agricultural industry, which allows them to cultivate about 50% of their land. As you can see on this map, about 1/3 of the land is also large forests, which can contribute to clean air quality and good soil quality. Their warm climate helps grow their agricultural sector by being able to grow grapes and produce wine, which is one of their biggest sectors. In regards to telecommunications, biotechnology, aerospace advancements, France excels in promoting the development of those technologies. And they also have robust machinery, chemicals, automobiles, electronics, all that type of stuff. And all those sectors impact the environment one way or another. And they also get 80% of their total electricity from nuclear power. A shift away from industry over the past 40 years has led to many improvements in France's environmental issues. However, they can always still improve, as their increase in transportation infrastructure has caused the emissions produced from that sector to remain constant. They try to mitigate this by enacting a sticker scheme in 2017 that required drivers to display anti-pollution stickers on all vehicles. They came in one of many different colors that indicate the vehicle's age, cleanliness, air criteria, otherwise known as its crit air. You can see that on the PowerPoint slide right there. The main goal was to ban less clean vehicles from the city in an event of high pollution situation, which they've had in the past. Also, the decentralization of France has led to decreased phosphate particles in water, which is good, but there's been a slow increase of nitrate concentration. This is due to the big agricultural sector and the runoff of water from livestock and pesticides. But France is adding a lot of infrastructure and tactics to mitigate this. And also, since people are becoming wealthier in France, their solid waste use has increased in the past 20 years. But France has passed legislation for food waste. As you can see in the picture, supermarkets are now restricted from throwing out edible food. So they're really trying hard to increase their environmental status. Some of France's policies, practices, and plans show that they are very concerned and dedicated to creating a cleaner country. The Eco-Phyto Action Plan is helping to reduce pesticide use on farms, and more wastewater infrastructure plans are being implemented. In the past 15 years, environmental-related jobs have increased by 36%, and more students are taking environmental classes in school. In cities as well, green zones are becoming more popular, and they're used to promote sustainable transportation and infrastructure. Also, the government is strongly supporting electric car production and provide monetary benefits to some who drive them, which is awesome.